phase 2 of the country's vaccination rollout started this week. We now take a look at how vaccination drive for prisoners over 60 years old is going. We're joined by the Department of Correctional Services and National Spokesperson, Singabakho Nxumalo. Good evening and thank you so much for your time tonight. Let's just begin with how the process is unfolding.
A very good evening and thank you for having us. As Correctional Services, everything has started very well. We're working very closely with the Department of Health. The district officials are the ones who are really assisting us in terms of making sure that all those who are 6 years and above in our care are allocated to the necessary jabs for inoculation. And what we have since discovered is that a number of our facilities will have inmates who are 16 above, but the numbers are very small. So we are working out a plan to say, do we then move them to other centers where, they can make up at least reasonable numbers so that when they open, let's say, a pack, you don't have other vaccines going to waste merely because, you don't have sufficient numbers. But where we had big numbers like in Krugersdorp, vaccination was conducted yesterday. So I think we are well on course with this particular program.
What numbers are we talking here?
When we looked at the inmate population, focusing on those who are 60 years and above, we have 5,256. So this is the category which is a priority for now. You will know that in total in South Africa, we have just over 140,000 inmates. So then it's just 5,256 who are 60 years and above. I think we will then have bigger numbers when we move even below the 49 and above. I think the moment we start going into 30s and above, that's where we'll really have big numbers. I think we've said it before that our inmate population in the country is getting younger, so these numbers depict that particular trend.
And let's talk then about, the situation, of course, that remains worrying, and that's the situation of COVID-19, and not only in prisons, but certainly, across the country, but certainly a situation of grave concern, I would imagine, for correctional services facilities, especially when you look at some of the concerns over the years of overcrowding.
The third wave is here, and as correctional services, we've made it a point that our strategy remains flexible, looking at prevention measures, as pillar number one. To say, but then should it happen that the virus finds its way inside our centers, how do we contain and treat those who test positive? And then looking at, and also going even further to the third pillar, which is disaster recovery. Fortunately, we've not reached that stage. We have had episodes where you will have a big number, such as in East London, I think in 2020 around June, where we had an outbreak. Then late last year, it was Storm, where we had to go into pillar number 2 in terms of containment and treating those who have tested positive. So thus far, when you look at from when COVID started, we still have about 7,408 officials who have tested positive, but a number of them, have since recovered. I'll provide those figures. But when it comes to inmates, it is only 4,285. But what is interesting, if you look at active cases, it's only 246. Unfortunately, we have lost 240, and majority of those being our officials. It then does demonstrate that prevention measures, in our correctional facilities has worked. However, our officials remain vulnerable. And the reason for that is that majority of them stay, outside our facilities. They stay with their families. And when they get infected out there, unfortunately, they can't report for duty. They have to be treated up until such time that they recover fully. Then they can report back at work. But as a department, prevention measures, infection prevention control are the key, and we've seen that working.
And Singabakho, certainly as you talk about the second wave and how much of a headache it then became for the department, let's look also then at, there's another facility, and that was Helderstrom Maximum Center in the Western Cape that also had to be put under lockdown. Are you then envisioning that you may find yourself in a situation like this where you may have to put some facilities under lockdown in order to ensure that there's no further spread of the virus?
I think what COVID-19 has taught us is that it also, changes its way, how it operates as well. And hence, as a department, we've said, look, we must be flexible, we must open our eyes, and we must, remain objective in what is it that we're doing in terms of protecting our officials, protecting inmates. And when there has been, let's say, infection find its way inside our centers, how quickly are we able to go down there, and then employ necessary measures, to contain the spread, and also treating those who are positive. And then as a department, we've been very transparent and objective to say the moment you have more inmates or even officials testing positive, we have to make it a point that all that is necessary is done in terms of decontaminating that particular area, and also tracing those who could be direct contacts, even going as further to say investigate how did it happen, so that you can find that particular gap. And what it has done is that it has even sharpened us even in the measures that we employ across all 243 centers in the country. And hence then as a department, we've been able to say, should it happen that, there is a particular spread somewhere, let us go in there, let us fight this, because it's clear to us that, COVID-19 is going to be with us, for some time. And you will have people coming in and out of our facilities. And then as a department, it does challenge us, but we're saying, we are ready. We've managed to put up a serious fight. And I think appreciation must also go to our officials, who've been, really, out there, not giving up to say, whether there is a pandemic or not, we have to do, our job, and we have to protect ourselves, even, spreading that awareness even to those who may not be in our care.
And which facilities then would you say that you're watching very closely that may have been problematic in the past?
With COVID-19, every facility matters, no matter how small or big it is. But yes, where you have a bigger inmate population, then you have to be even more vigilant, because should you have, let's say, an outbreak there, then you know that you've got a serious case, at hand that you need to deal with. So we are watching all of them. We have what we call National Operations Center. That's where all centers, report what is happening at the ground level. And should we pick up that, there's a spike, we investigate what's the cause of that, and then we make it a point that necessary measures, are implemented. So that, in a way, does give us, an immediate reaction. So we're able then even to put, other proactive measures should we pick up that perhaps, in a particular area, something which may not be going right. And where, if let's say one particular center is struggling, maybe either with officials on the ground or maybe is running out of particular PPEs, then we're able, to jump in there and there. So the National Operations Center has been very instrumental, because it gives us that presence, in across all correctional facilities, so that you don't have a particular center which will say, what, we are strained, we do not have the following. So as a department, I think we have managed to put our presence there, and we've managed to say, whenever you need help, please shout, and we are there to provide, that help. And Department of Health, has been really phenomenal in the type of support that it's giving us.
And when you then look at, behavioral change, because that has been one of the things that, officials are talking about time and again, to say that people need to change their behavior in order to ensure that they also do their part in curbing the spread of COVID-19. Would you say then that when you look at correctional facilities, there has been a difference that has been made somewhat when it comes to behavioral change?
That has happened, because even when you talk about fatigue, people could be fatigued. I think it's just a matter of, of life and, as human beings. But the moment they hear that, hey, Bongiwe has contracted COVID-19, immediately people, they will jump and remember that, we can't afford to let our guard down. We need to do whatever is possible, to adhere to COVID-19 protocols. And the morale that we have, down in our centers also does assist us, in a way. Even, how inmates will also conduct themselves, because with COVID-19, it's all about, personal responsibility. You can't say, if my neighbor is doing all that is correct, therefore I need to relax. So each person, has to take responsibility. And inmates, I think, do understand that. Even with new ones who get admitted, I think what opens the eyes is that we don't take them into the general inmate population. We put them aside for at least a period of 14 days before we move them to the general inmate population. And then that on its own, does signal that, we live, we are now living, in different times. And we've seen that working. Because how it has helped us is that should it happen that maybe one person may not have been detected or the virus, or that person may have been symptomatic, then we're able then in that 14 days to pick up that, this person, is COVID-19 positive, and then we're able then to even lock down that particular area and then monitor all those people who are there, treat them if it's necessary. If they have to go for testing, they must be tested. So I think as a department, all these measures that we're putting in place are in a way are assisting us, to create that buffer to say, if we've got to perhaps one area where there's been contamination, lock that down, deal with it, and then protect the rest. Hence, even with our own officials, we are not deploying 100% because we need to deal what we call exposure. The moment you expose all of them, should it happen that that they conduct a virus, that will mean you no longer have soldiers on the ground. So as a department, we've even had to come up with how best are we able to rotate our staff, and also even making them to say, if you happen to attend a funeral, you've got to disclose that so that we can see how best, we are able to then maybe give you other days off, so that should it happen that maybe, the few days after that, you may think you're fine, but only to learn a few days later that you are now positive, we're able then to pick that up and then get necessary treatment if there's a need to do so. So I think personal responsibility has helped, continuously reminding colleagues, engaging inmates, and others will say, we are tired, we've been living like this, having to wear a mask every day is tiring. But now people are getting used to it. You no longer have to remind them. So I think as a department, I think we've done very well in terms of that, even, making a point that we don't run out of PPEs, producing our own mask, has also assisted us so that we don't rely fully on the fiscus.
And let's then talk about some of the reports that have, filtered through. One of the publications, the New Frame, is reporting that some of the inmates are really fearing for their lives and saying that some of the regulations to curb the further spread of COVID-19 are being flouted, saying that they're putting their lives at risk. They also even claimed to this publication that they're being subjected to unhygienic environments, and they also claim that the masks that they are then being given are of poor quality, and sometimes they don't even get masks at all. What do you then say as the department to some of these claims contained here?
We were fully aware of what may confront us. Hence, there was no area for us where we could, relax, and just say, let's do this thing, get over it. We also needed to make it a point that, we protect lives. So before we even started producing those masks, we had to take them, the necessary testing to check if indeed they are safe, and we did receive that particular approval. So there are specifications, that we're following in terms of producing those masks. So we have seen these reports before, but the good thing is that numbers do not lie, and we update them, on daily basis. We're also aware that at times people may want to make the situation as if it's so dire. We'd hope that perhaps, it may push the system to bungle somewhere and in a way then find to get their way. Unfortunately, it's not going to be like that. We are fully in control of what is happening. The type of masks that are produced in our centers are of perfect quality, if not even better, with some that you find in the market. And we make it a point that we don't run out of stock. Hence, I've said we have the National Operations Center, which is giving us, reports, it's real-time reporting. Then we're able to say, okay, at this particular center in Vryheid, this is what is happening. If you, let's say, maybe you have a nurse or an official testing positive, you're able to locate, okay, where is this official and what's the name of the center? If it's inmates, who is this inmate? When was this person admitted? Was there any movement? So so that mechanism on its own, has managed to assist us. So even if, let's say, you will have inmates who will feel like that they are vulnerable and they are not sure of whether they are protected enough, we say there is no such, because heads of centers, supervisors are also there on the ground. And there's what we call a request that inmates are able to make on daily basis every morning. You even have an oversight body like the Judicial Inspectorate for Correctional Services. When people feel that they are not being listened to, they're able even to report with that particular body. So as a department, we are quite comfortable with measures that we managed to put in place. And I think the recoveries that you've seen of 11,196 out of 11,693 positive cases does indicate to a fact that a lot has been done and done the correct way. So even the numbers of inmates who have contracted COVID-19 and those who have recovered does talk to that particular fact. So those who think that they can come up with these creative stories, thinking that maybe the system would bungle somewhere, unfortunately, it's not going to happen. We know of what we're doing. We continue to monitor it, and where that gaps, we are able to quickly jump in there, adjust, if we have to do that. And even the overcrowding levels, have reduced quite significantly. So at no point will then say, we don't have a choice, because we know exactly how to manage this situation now.
All right. Thank you so much for your time tonight. That was Department of Correctional Services National Spokesperson Singabakho Nxumalo, who was discussing the progress in the vaccination drive for prisoners over the age of 60. Let's take a